The 112th Congress gavelled into session this week, and NCPA President John Goodman told Fox News the tsunami in healthcare costs is one of the first issues they'll have to grapple with.
Well, we have a problem on our hands because beginning this month, about 10,000 people every day for the next 20 years are going to be turning 65. And they're going to expect Social Security, they're going to expect Medicare, and the problem is all of the taxes that they paid have already been spent. We didn't save any of the money.
So what about the baby boomers, retirement, and health care taxes? Dr. Goodman explains that the new health care law, often called Obamacare, dealt a heavy blow to the funding of Medicare, since the new law keeps Medicare growing at the same rate of the payroll tax we pay for it.
So what that means is that what Medicare is going to pay for the baby boomers' health care, the rates are going to be way down here. Everybody else is going to be going like this, and the gap between what the government pays for Medicare and what all the other patients are paying is just going to grow wider and wider over time.
So what's the solution?
You know, I think more and more patients are going to turn to concierge doctors, going outside the system, paying people out of pocket to get doctor services that Medicare isn't going to be paying for.
NCPA Senior Fellow Devin Herrick testified before the Senate Committee on Commerce, Science, and Transportation, chaired by Senator Jay Rockefeller, that the so-called mini-med plans that make it affordable for employers to provide low-income workers with health care are necessary for businesses to control costs, and those workers need them.
Mini-med plans provide a level of benefits that many Americans come to rely upon, and the loss of this coverage will make them worse off.
Then there's also the question of the Fed's policy of quantitative easing, Part 2. NCPA distinguished fellow Bob McTeer told CNBC's Larry Kudlow that he thinks the policy is correct, but the Fed could have spent less money and not been so loud about it.
The Fed is not spending taxpayer money. The Fed is buying something that it can sell later. Everybody thinks the Fed spent a lot of taxpayer money during the crisis, when, as a matter of fact, it earned a lot of profit for the taxpayer and for the Treasury during those operations. Think of this, Larry, like you would think of the surge in Iraq. We were doing okay, but not quite good enough, and more was needed, and the more helped a lot.
Climate change will also be on the early agenda for the incoming Congress. NCPA Senior Fellow H. Sterling Burnett told the BBC that neither the United States nor China will want to become part of a global climate change effort.
Many of the people who joined the Congress were even more skeptical of the climate science and certainly more knowledgeable and skeptical of the climate economics than those who came before them. They're not going to join any treaty that makes the U.S. put on a hair shirt.
The NCPA also ended the 2010 Sumner's Distinguished Lecture Series with policy analyst and former State Department official Liz Cheney, who noted that global leadership for the U.S. is not a choice.
I think that for us and for our exceptional nation, leadership is a moral obligation. We can't choose to lead. We simply must lead. Because there is no other nation with the capacity that we have, by the virtue of our freedom, of our history, of our values, and our resources, who can lead this world.
Thanks for your support of the NCPA in 2010, and here's looking forward to the important work we'll be doing together in 2011.